event is titled Featured Products, What's New in Wound Care for ED. There are thousands of wound care products on the market today, and there are so many important details to remember when treating ED. So it can be difficult to recall which dressings are best suited for which wounds. National Rehab and ED Nurse are hosting this live webcast today to help you understand the features and applications of several advanced wound care products. NR ED Advocate team members Danielle Malcheno and Bill Kornman will lead today's presentation. They will talk about collagen dressings, honey dressings, and foam dressings. Danielle is our specialty account manager and a registered nurse. Bill is our specialty product manager. After Danielle and Bill's presentation, we will open up the forum for questions. We hope this live format will help clarify the differences in advanced wound care products and help you think of questions to ask at your next doctor's visit. I now ask you to please welcome Danielle and Bill.
Good afternoon. This is Danielle. The goal of our presentation today is basically to introduce you to the team members, understand a little about the features, benefits, and application of various products, collagen dressings, honey dressings, foam dressings, and a few other products that have been recently introduced, and how to choose a dressing that best meets your needs in treating your ED.
Hi, I'm Bill with National Rehab. I've worked with National Rehab for 17 years, and I work with leading manufacturers to understand the principles of how their products function in the wound healing process. And in light of that, I'm always searching for new products that will protect the fragile skin and facilitate the healing. And I've been involved with the ED community for more than 10 years, and I assist customers in obtaining dressings. That's our specialty, is billing insurance companies for the dressings that we are providing, and that's the navigating through the complex, twisted insurance system for billing purposes.
This is Danielle again. I've been a nurse for 28 years with various backgrounds in the clinical environment, from intensive care to the ER to family practice. I've been a member of National Rehab for 10 years. Most recently, last fall, I had the opportunity to earn wound care certification so that I could better assist and provide education when needed. I've been part of the ED Advocate team with Bill for the past 3 years. In my role, I have an opportunity as a representative of National Rehab to volunteer as medical staff with some of the various camps, such as Camp Discovery. I will be attending Camp Armadillo in Texas, and hopefully I have a chance to see some of the children there. I've been at Camp Horizon. I just came back from Camp Wonder last week, which was a fun-filled week for all of us. And for 3 years, I've participated in Camp Spirit in Denver, Colorado, which is the winter adventure camp for recessive dystrophic children. I work closely with many of the leading dermatologists nationwide to increase their awareness of National Rehab and how we're involved with ED and how we can assist patients in navigating insurance and getting their products. In addition, I provide education on some of the latest wound care dressings that are out there and let them know what is new to the market. Few pictures, just that we spoke a little bit about ourselves, but it lets you see a little bit about who Bill and I are. And the first product we're going to discuss is collagen dressings. Collagen dressings basically will help jumpstart a wound that isn't healing. It acts as a scaffolding and provides tissue strength to the wound bed. It absorbs drainage, it helps maintain a moist wound environment, and it's easy to apply. And most importantly, it won't adhere to the wound. And for applying the dressing, it is very easy. It's applied directly to a wound as an initial dressing into the wound bed.
Something to keep in mind with collagen dressings. You want to cut the dressing to the size of the wound because You don't really want the collagen overlapping on the tissue surrounding the wound because it's actually wasting the product if it's not making contact with the wound. And theoretically, in essence, what you want that dressing to do, you want it to disappear and be absorbed into the tissue. If you go to change the dressing and you see that the collagen is still in place and it has not disappeared, you perhaps need to wet it if it's somewhat of a dry wound. But again, the goal is to have that collagen dressing absorb into the tissue so that it then can jumpstart a chronic wound. And it is to be used on a chronic wound. Something also to keep in mind is that you don't want to be using this collagen dressing on an infected wound. If you are attempting to use it on a wound that has too high of a bacteria count, it's not going to be effective and you're wasting the dressing. We have different types of collagens. We currently have a Promogram and Prisma by Cystogenics, and we have the Puricol and Puricol Plus. And both of these dressings also have a little bit of silver in, just for a prophylactic issue, in case there is a minor amount of bacteria in a wound. The small amount of silver perhaps may help to allow the dressing to do what it's supposed to do, and that's to jumpstart a wound.
Well, you mentioned there's silver in there, or do they always have silver, or is there a collagen product without silver?
In most cases, you're going to use a collagen dressing without silver. I actually believe the reason they put silver in is because the United States, our country, is actually becoming overwhelmingly excited about silver. Silver manufacturers are literally putting silver in everything, and so why not put silver in Promogram? But I look at that almost as an oxymoron, because you are not supposed to use Promogram or any collagen dressing in a wound that has too high of a bacteria, so why are you putting silver in a collagen dressing when you shouldn't be using a collagen dressing in a highly bacteria-filled wound? So, and it's not that much silver anyways. I actually really believe that the silver is not very effective.
With a collagen dressing, do you cut it to fit the wound size, or how do you utilize this?
You do. You cut the wound. You cut the Promogram or the Prisma or the Puricol, any collagen dressing. You cut it to the size of the wound.
The next dressing is honey dressings. Features of this: they maintain a moist wound environment conducive to healing. It's best for partial or full thickness wounds, ideal for wounds that produce moderate to heavy levels of drainage, and it's very easy to apply. In application of this, you put it directly on the wound as the initial dressing, and it can be used with other dressings along with the honey dressing. The first we're going to speak about is the Manuka HD.
Manuka honey dressing is a new dressing that we've brought in. It is 100% Manuka honey from New Zealand. It currently is available in a pad form. If those of you have tried the Manuka honey versus the Medi honey, you'll see that the Manuka honey pad is softer, it's more pliable, and what they do is they impregnate honey into an alginate dressing to assist that dressing to absorb some drainage. It's a very effective dressing to decrease bacteria in a wound. It acts as an antimicrobial, even though the manufacturers are not permitted to state that it is antimicrobial, but it does act as an antimicrobial. The only problem with a honey dressing, whether it be the Manuka honey or the Medi honey, that is that it tends to sting initially. All honey dressings will sting initially. I'd also like to mention that in Europe, honey is the biggest dressing used to decrease bacteria in a wound versus the United States. The United States tends to use more silver than they do honey, but honey can be very effective in reducing bacteria in a wound. Now we move on to the Medi honey. Medi honey is, again, it's Manuka honey as well as a combination of other forms of honey from New Zealand. It can be used in all phases of wound healing, and it can be considered a key dressing in any wound bed preparation. Again, it will act as a antimicrobial dressing. Medihoney also comes not only in a pad form, but it comes in a tube, and it is coated as a hydrocolloid filler. Not that that's important to you all, but that allows us to bill the Medihoney in the tube. I've been told by some pediatric derms that the pad Medihoney will sting less than Medihoney in the tube. But the Medihoney in the tube can act as a topical, and but some people claim that it stings more than it does the honey in the pad. But again, that's up to the parent or the child. Actually, more important to the child to tell you whether it stings or not, which stings more than the other.
So can you use this on top of a contact layer, or would it be directly on the wound bed?
Oh, that's a good question. You can use it as a contact layer, but your contact layers are somewhat of a unique thing. There's a variety of contact layers. The contact layer that most people are familiar with might be the Restore contact layer, or the Monlica Mepitel, or the Cystogenics Adaptive Touch. You can apply the honey either directly to the wound, or you can apply the honey as a topical on top of the contact layer. There's also contact layers that are not impregnated with anything, which would then be a very good combination using something similar to an extra dry contact layer in conjunction with the Medihoney. Yes, that's possible.
Foam dressings. They provide warmth to a wound site. They'll not interfere with new growth of tissue. They pull drainage away and absorb drainage. They expand and conform to the wound to still and protect the wound bed. Along with that, they'll cushion the wound site to promote patient comfort. They help in keeping the wound bed moist and preventing dressings from sticking to the wound bed, and it makes dressing removal pain-free. They're also very easy to apply. Application of those, they can go directly on the wound as an initial dressing, or they can go as a secondary dressing over something else. They may be used underneath a compression dressing or a wrap, and they could be cut to size to fit any size that you have for the wound or the area that you are trying to protect.
Foams. There are hundreds of foams available on the marketplace, but what I've found to be the most effective are a variety of foams used by the EB community. First one we're going to talk about is the Monlica foams the Mepilex foams by Monlica. And as you can see on the screen, probably the most common foam used in my EB community is the Mepilex Transfer. It comes in large sheets, 6x8 and 8x20. It's an absorbent, soft silicone. The part of the foam that makes contact with the skin is the silicone coating. All Monlica foams are impregnated with silicone. It's traumatic to the wound and surrounding skin upon removal. When you the interesting thing about the Monlica products is when you go and remove a foam that has the silicone coating, it will theoretically not cause any trauma to the wound nor any trauma to the skin surrounding the wound. And it minimizes the risk of skin breakdown and may remain in place for several days depending on the condition of the wound. That's the Mepilex Transfer. Very nice dressing. It's very low profile. It's a nice dressing to use in the summer because you don't really want to bulk the kids up in the summer due to the heat.
So how do you make a decision on to use a regular Mepilex or the thin or the Transfer?
Okay, the Transfer is somewhat unique, and if you think about the word transfer, that's what it's intended to do.